We're now going to talk about the importance of the pelvic floor exercises during pregnancy and following birth. The pelvic floor is the hammock of muscles that supports the internal abdominal organs of the bladder, the bowel and the uterus. If you take a look at the slide, you can see how complex this is and how it goes from the pubic bone at the front and attaches to the spine at the back. So we can imagine actually during pregnancy how much extra weight that pelvic floor is having to carry. And it could be that you're carrying between an extra 10 to 15 kilos of weight by the end of your pregnancy. If we think about the weight of the baby, the weight of the placenta, the additional bulk in the uterine muscle in preparation for birth, the additional fluids that we're carrying, the amniotic fluid, the additional blood volume that we carry during pregnancy as well. So it's really important that we do pelvic floor exercises to support the additional weight that we're carrying. So do start doing them in pregnancy and then carry on doing them after birth. How do you do pelvic floor exercises? Well, very simply, if we think about the muscles we use to stop the flow of urine and the muscles that we use to stop the passage of wind or to help go to the toilet for number 2. Thinking about these muscles and trying to isolate them. So you don't have to pull a contorted face when you're doing pelvic floor exercises. We could be sat here quite happily doing them and actually nobody know any different. But think about those muscles. So the muscles you'd use to stop the flow of urine or to hold a tampon in if you've used tampons previously. Also thinking about clenching the ones around the back passage as well, and doing some short, sharp squeezes and then some longer squeezes and holds of up to about 10 seconds. Have a go at doing them. If you're going to do pelvic floor exercises during the pregnancy, encourage you to have an empty bladder first, not to try them by going for a pee and trying to stop the flow of urine. Urine infection is more common in pregnancy because of the pregnancy hormones softening and relaxing all the muscles in the body. So we don't want to be stopping and starting that flow of urine. Make sure that you've got an empty bladder. You may wish to invest in an NHS app called Squeezy, which is a great app that kind of pings and reminds you about doing the pelvic floor exercises. So we're looking for around 3 times a day of doing 10 short, sharp squeezes and 10 longer squeezes and holds. Try to relate them perhaps to an everyday activity, maybe making a cup of tea, maybe preparing a meal, maybe brushing your teeth, so that it becomes autopilot to do them. Ask your birth partner to do them with you and to encourage you and to remind you of doing them. If you don't do pelvic floor exercises and we don't get that strength back in the muscles that have been stretched during pregnancy and birth, it can lead to leaking pee when we don't mean for it to leak, or to problems later on in life. So it's so important to maintain that strength and to get it back following birth. So have a look at Squeezy, set yourself a daily reminder to do those pelvic floor exercises, encourage your partner to do them with you.